Welcome to Irony News.
Hi, my name is Emily.
Hi, my name is Angela.
Hemochromatosis is an inherited genetic disorder that causes the body to absorb too much iron. Unlike most people, the iron that is absorbed 2 to 3 times faster from food is not excreted but stored.
The liver is the first organ to store the extra iron, then the heart, the pituitary gland, and then other parts in the body.
If not treated, it can eventually be fatal. Type 1 and 4 are adult onset disorders. Men with type 1 or 4 develop symptoms between the ages of 40 to 60, and women develop symptoms after menopause.
Type 2 starts at a young age. Symptoms appear in childhood. At age of 20, there is a decreased secretion of sex hormones.
Type 3 starts at young age. 2 abnormal copies of the mutations are required to produce the disorder.
Type 4, also known as ferroportin disease, occurs in adults. There is a 50% chance of passing this type 4 disorder to offspring.
Hemochromatosis is a point mutation by substitution. It affects chromosome 6.
Now we have a special clip from L.G. Douglas School. Teacher, why are we here?
We're going to the big room with a huge map because we have a guest specialist that's going to talk to us about hemochromatosis.
Okay.
Alright, come sit here. Such a sweet girl. Okay, let's welcome Dr. Lee.
Yay!
Hey kids! Hi, my name is Dr. Annika Lee, and I'm here to talk to you about hemochromatosis. Yeah. Oh, do you have a question?
Oh yeah, where's Tommy?
Oh, Tommy Brown is the reason why I'm here. His father, Mr. Brown, is very sick. He has been recently diagnosed with, or a doctor told him that he has a boo-boo, so he's sick. Yeah. I'm going to talk to you about some symptoms, which are, so what shows up when you're sick, okay? And some fun facts, interesting facts.
Next up, we are going to talk about the symptoms.
And cut. That was a great shoot, you guys.
Baby girl.
We're going.
Watch you.
Okay. Oh, okay. My stomach just hurts.
Okay.
And my shoulders.
You wanted to talk to me about...
Yeah, I need to tell you that the schedule has changed. We're going to add in something here and something right after the next commercial break.
Yeah.
Oh, my back.
Did you lose some weight?
Have I? I don't know. I've just been really tired.
Oh my gosh!
Hemochromatosis came from Ireland. So it originated, or it comes from 40,000 years ago. Very old. Yeah, 40,000 years ago. And it was actually to keep the Irish people, who back then couldn't get as much to eat. It was very hard to get food, and this was actually something that Mother Nature actually developed, a disease that was developed to help these people because it helped them keep iron in storage. But now it is actually a toxin because of the overdose that comes from this iron, or too much iron in their system. If you guys have heard of the book The Pearl?
No. My sister read it.
Yeah, they would have read it around grade 8, and the author actually had hemochromatosis. And yeah, he lived in Tibet for a little bit, and the natives there actually commented on how dark his skin was, because when you have hemochromatosis, your skin actually gets very tan. So people complimented him, and they were like, "Oh, your tan looks great." Yeah, but it turns out he had liver cancer. So this shows how hemochromatosis is actually misdiagnosed, and that's why Tommy's daddy is sick, because people told him that he had a liver disease, but it turns out he had a different disease. So the medication and the treatments that were given were actually bad for him, very bad. It hurt his boo-boo.
How many people have it?
Oh, that's a good question. I'm sorry, I don't know your name. That's a good question.
It's okay.
1 in 9 Canadians have it, so it's very sad for those people.
I know, that's
Yeah. So there's 12 of you in here, right?
Yes.
And counting the adults, there's 18, and so that means if you were thinking about this mathematically, or with counting numbers, 2 of you guys would have hemochromatosis.
Oh no!
Yeah, and out of the whole world, 1 out of 200 people have it. So our whole school, there's around 2 or 3 people that would have it if this was Earth.
Oh no.
Yeah, and Caucasians, and especially the people of Irish descent, have it more because of the Celtic people. Oh yeah, so it originated in Ireland, and Celtic people were more prone to it, as I stated, because of storing extra iron in their body. So Irish people are more prone, so 1 out of 50 people have it, of Irish descent, and 1 in 400 Caucasians have it. So many people do have it, but if it is caught quickly, we can prevent it from hurting more. So yeah, so after your teacher will explain some of the symptoms as I have to go, and if you notice any of these symptoms within your family, just don't hesitate to go to the doctor. Okay, kids?
Okay. Thank you, Dr. Lee.
No
Thank
problem.
you. Thank you. Let's give another warm hand to Dr. Lee. Thank you. Bye. Bye. Thank you, LG Douglas School. Okay, so let's check back on our camera woman. She just fainted here a while ago.
Hello, this is Samantha Clark reporting live from the Lower Mainland Hospital. One of the staff from RNE News just fainted. We believe it's from hemochromatosis. Let's take a look. How are you feeling?
Hey Samantha, I'm okay.
You are diagnosed with hemochromatosis. So, how did you feel before you faint?
I felt really tired. I had a huge headache. I was sweaty and red in the face. I was always losing hair, which I don't know if that counts, but
it is, yeah.
I was always just really tired, and like I said, I think that was the biggest thing, and my stomach really hurt. I had back pain, and my shoulder really hurt. I don't know, I lost a couple pounds.
Yeah, that's one of the symptoms and factors. Skin.
I think...
Did your skin go dark?
Oh yeah, I noticed that I was a couple shades darker than my foundation was.
Yeah.
And I didn't go out in the sun, so I don't know what it was. I looked green sometimes, and sometimes red, sometimes kind of orange.
Alright.
Like Snooki.
Alright, yeah. So, do you have any more questions?
Yeah. Well, we'll interview the doctor shortly. We'll just let our patient rest. Hi, this is Samantha again. We're here with Dr. Chan to talk about the diagnosis of what happened to our staff member.
Okay, so DaIn got our transferrin saturation test, which is a type of blood test. But another way to get to determine the amount of iron stored in the body is serum ferritin test. Test to examine the liver, because the liver will be damaged when you have hemochromatosis. Is liver biopsy, CT scan, MRI scan, or ultrasound. Okay, I'm gonna head back to DaIn's room, and I'm gonna talk to her about the treatments. You should come along.
Okay, so let's go see how DaIn's doing.
Alright, so DaIn, okay, I'm going to talk to you about the treatments. How are you feeling? Hey.
Kind of dizzy. Hi.
Do you want to hear about the treatment right now?
Sure.
Okay, so basically, 1/2 liter of blood is going to be removed from your body each week until
Each week?
Yeah,
That's how much I give per month.
Because your iron level is really high right now, so that's the best solution. So basically we're gonna do it until your iron level is normal. This may take months or maybe even years, depending on how severe you are right now.
So I won't be able to give donations anymore?
No. So
Okay.
it's okay. It's not that bad right now because it's discovered really early. But then after if it's normal, the procedure might still be done less often. So you might still have to do it to keep it normal.
Okay.
So the best thing you can do now for your diet is don't drink any alcohol. Do not take any iron pills or vitamins. Have you been taking those?
Yeah, I've been taking iron supplements because
Yeah,
I'm a vegetarian.
don't take those anymore. And do not use iron cookware. Yeah, that might be surprising, but yes. And do not eat raw seafood.
Oh.
But cooked ones are fine. And do not eat foods fortified with iron, such as 100% iron breakfast cereals.
Okay.
Yeah, so basically that's your treatment. And it will just have to remove 1.5 liter of blood each week.
Okay. So
Alright.
nothing serious like a surgery or anything?
No surgery is needed.
Okay.
So, back to you.
Okay. So this concludes our segment with DaIn. I hope you'll feel better, DaIn.
Thank you.
Back to you guys, Emily and Angela.
Thank you, Samantha.
Thank you, Dr. Chan.
And this ends our knee news for today. Thank you for checking in. Bye.
Bye.